Why dog develop pulmonary edema in left side heart failure? Hello, this is Dr. Luis. Today I'm going to use TCVM to explain why dog develop pulmonary edema in heart failure and also tell you how to treat the pulmonary edema or heart failure from TCVM view. In Western medicine, pulmonary edema occurs when the heart failure fail to, especially the left side heart failure, the heart cannot pump the blood efficiently, and then pressure build up in the pulmonary blood vessel, and the fluid just leak out of the blood vessel and cause the edema in the lung. But from the Chinese view, we look at the problem in different way. So in this kind of situation, there are multiple organs can be involved in this kind of situation. For example, the heart, the kidney, the spleen, and the lung. So from the TCVM view, the heart governs the blood. So if the heart qi is good, the blood or circulation in the body. When the heart qi is deficient, then the dog will develop to heart disease. And if the heart qi become weaker and weaker, then the heart cannot move the blood in the body and gradually cause the fluid in the lung. And the second is when the heart qi is weaker, or the situation become worse. Maybe the animal will develop into the yang deficiency, while the heart yang or kidney yang cannot warm up the water in the body or the fluid in the body and cause the fluid or the water accumulation in the lung and cause the lung edema. And as we all know that the lung, from the Chinese traditional medicine view, lung has a very important job, which governs the qi and regulates the movement of the water. When the lung qi deficient, it will cause the edema. And also the spleen, as we all know that the spleen has the function transform and transport the nutrition and the water in the body. When the spleen qi is weak, the fluid cannot process the properly, then it will develop into the dampness. So such as the water in the area of the body. If the water is in the lung, it can cause a phlegm, or we call it, or sometimes it's edema. When the animal getting older, then the kidney also be involved. The kidney governs water, control the body fluid. When kidney qi or kidney yang deficient, body cannot properly transform the water, cannot control the water, and the fluid gradually stand in the lung, and the lung edema getting worse. So from the TCVM view, so there are multiple organs are involved in the lung edema: heart, kidney, lung, spleen. So in this way, the treatment would be, we need something to tonify the qi, tonify the yang, and also to help the body to absorb the fluid, such as the Chinese herbal medicine Zhen Wu Tang is a very good choice. And we can use some acupuncture point to help to tonify the heart qi, to tonify the yang, such as back-through association of the heart, and also the yuan source point of the heart, and also the GV3 and the GV4 can also tonify the yang. So this is acupuncture point that we can use. Okay, so You see, understanding the underlying pattern help us to choose correct TCVM treatment plan. I hope this video can help you understand the heart failure lung edema from the TCVM view. Bye.